a licensed clinical social worker. I am currently employed at the Department of Veterans Affairs as an outreach coordinator for homeless veterans, and I am the owner of Premier Professional Counseling Services. It is a full-service mental health agency. We have about 5 therapists there on staff to meet any needs that anyone has. We should be able to handle those needs. The only thing that we don't do currently is provide medication. So we do refer out for that. I'm also the founder of the Pink Lotus Project, which is a nonprofit organization that empowers women and mentors girls. So we have actually 7 girls from our mentoring program that are graduating this year. So we're super excited about that.
Oh, that's amazing. Well, thank you so much for being here, Jocelyn. And I know the Lotus Project, you guys have done so many different things with that. If I remember right, each year for prom, you guys have dresses that are available. Tell us about that.
So one of our initiatives was to empower girls and to help families who were having financial difficulty in getting their children the prom dresses that they needed. And so we wanted to be able to offer those prom dresses to those girls for free. We realized that prom is a monumental time in a girl's life, and we didn't want them to not be able to attend things that are important to them as high schoolers because of finances. So we collected dresses all year and were able to ask the girls to actually come in. And the only thing they had to do to receive a free dress was to come in and do workshops. So we had workshops on different topics. We had some colleges to attend, seatbelt safety with the highway patrol. We also had self-defense class. So we've done several things for the girls to be able to get those dresses free of charge, and we just want them to come in and get some education.
That's amazing, because gosh, it's so expensive trying to, do all that stuff, and you certainly don't want anybody to miss out. So thank you for doing that. I know you guys have helped so many with that.
Mm-hmm.
So gosh, that's so exciting. Now, Jocelyn, you were on our board of directors for several years, and I was super happy whenever I found out that you had opened your own business. What inspired you to get that started?
Well, I actually had opened my business in 2013. I was just not promoting a whole lot, and I was only working from home and only working with private pay clients and doing a little bit on adoption home studies for individuals seeking to adopt. So I was only doing things just here and there, and my goal has always been to have a mental agency to be able to service individuals and for them to be able to bring their entire family if their family needed services. So that's always been a goal of mine, to have a service like that for individuals. So in 2017, I relaunched Premier Counseling Services along with 2 other therapists. And so we have grown exponentially over the last 2 to 3 years.
That is fantastic. So needed in our area.
Absolutely.
So tell everybody where you guys are located and what your hours are. How do they get in touch with you? Those kinds of things.
So we are located at 1390 29th Avenue, downtown Gulfport. We're directly behind Crescent City School of Gaming and across the street from where Cafe Climb used to be. So we're ducked off in a little area that we call Confidential Alley. No one would ever know that what you were there for unless they were looking for you. So it's kind of tucked off, which is a good thing for individuals' confidentiality. So we're tucked off there, and they can get in contact with us. We have a Facebook page, Premier Counseling Services, Instagram, as well as our website. It's www.premiercounselingservices.net, or they can call our office at 228-220-4226, and they can contact us that way.
That's fantastic. So, with Mental Health Awareness Month being this month, May, excited that you guys have those services to offer to people. Now, do you ever encounter, sometimes we talk to folks and they don't feel comfortable, or they're afraid to talk to their family or, their loved one or anybody to know what they're doing. Do you guys run into that very often?
We do, but we really try to make individuals coming in for counseling feel as comfortable as they possibly can from the moment that they call to make their appointment to the time that they have their appointment and they leave our office. Our goal is to make them feel comfortable. We are very open about what we do at our agency, so we want to make sure that we are breaking down the barriers and the stigmas of mental health as well, and not making it a taboo subject, but making it something that we all discuss and we all need to be aware of.
Very good, very good. You know, one of our employees is a peer support specialist, and so she has lived experience in now helping other people. But one of the things that she talks about is how she was so afraid. She had small children and was going through some things. She was just terrified that her kids were going to be taken away from her. So that's what prevented her from seeking help all this, all that time. And finally, when she did, none of the things that she had worried about happened.
Right, right. So we want to make sure that we cultivate a community and of caring. And so when one of us hurts, all of us hurts in our community. So we want to make sure that we cultivate a community of caring at our agency and let people know that it's okay. I tell people all the time, you would be surprised how many people have family members or how many people themselves have suffered from some type of mental health issue in their lifetime, whether it was situational depression or anxiety, or if it was, schizophrenia, bipolar. You just would be surprised about how many people who actually know someone who's suffering or is suffering themselves.
Mm-hmm. Goodness. Well, thank you for all that you guys do.
And thank you for all that you guys do. You have a wonderful program for your clients, and hopefully after some of this is passed over, you guys will be able to open up really soon and get things going again.
Oh, thank you. So, Jocelyn, I know that I have been fascinated by the vision boards that you do with people. Tell us about that.
So my vision boards was something that spawned out of my need for trying to figure myself out. I have a group of friends that I call my accountability partners. And so every year we get together and we complete vision boards. And so in completing that, I think I loved it so much I wanted to share it with other people because I'm a firm believer in manifesting what you desire in your life. Writing down those goals and making sure that you have a task list to go with those goals. So one thing that I tell people when they come to my class is that, you can put all of this stuff on this board, but if you're not willing to work for it, it's not going to happen either. So you have to be willing to put in the work as well when you're completing your vision board and being really honest with yourself about where you start.
Okay, so I did a mini one of those years ago, and just being able to see it, I had it somewhere where I would see it every day. It made me work harder. So I guess that, yeah.
Yes.
And you had one to show us on your phone.
I do. Now I can't find my phone. But I keep it on my phone. Okay, I think I put it up. But I keep it on my phone because that's something that I have in front of me all the time. If you think about how many times a day you pick up your cell phone, and you can take a glimpse of your vision board. So what I do every year is I take a picture of, oh my God, I think I lost my phone. I take a picture of my vision board and use it as a screensaver for my phone. And I'm gonna find it before we get off. But I use that as a screensaver so that every day when I dial someone, when someone dials me, when I'm just holding my phone or I'm playing games on it, I see my vision board. So it constantly reminds me to manifest the things that I want in my life. So I have it as a screensaver on my phone too. Yeah.
That's a great idea because you're right. We're looking at that thing all the time.
All day long.
So how do you guys, when you get together, do you have like magazines that you cut pictures out of, or what do you use to put that board together?
I usually offer affirmations. So I have affirmations there for individuals, magazines, I encourage people to bring pictures of things that are important to them, whether it's family, pictures of things that they would like in their lives, if they have something that's near and dear to their heart. So I asked them to bring in personal stuff as well, along with the things out of the magazines. And then we kind of use quadrant to put those things on the board, because I really like for those boards to be organized. So all of your things that you want to manifest with money is in one area. Everything that you want to manifest with your career is in an area. Everything with your family, education. So we kind of put it together like that so that you can be clear on what you're looking at. It doesn't look jumbled, and you know what you're doing. Know exactly what your goals are.
Nice.
Mm-hmm.
Gosh. And so then do you guys get back together to kind of see where you are with things, or kind of a check-in?
So what I've done in the past is I've offered a, for the people who attend my class, I have a Facebook group for them. And so I keep that Facebook running for about 90 days. And so we talk about how they want to move forward. And then we can go back over their vision boards. A lot of times people, it takes them a while to complete it because they really want to think on it. So they may not get it done in that 2 or 3 hour window. So we give them opportunity to come back and show their vision board later in that Facebook group. And it's a private space so that they can really talk about how they have felt putting their board together. And then they can get encouragement from other people who were there at the event with them.
That is so
I
cool.
found my phone. I knew I would find it. So here's my phone. That's my vision board.
Oh.
Some of the things that are important to me. I know there's some me time there, and why? Because I like to do a lot of type things. Family is super important. Business is important. So I keep that at the forefront every
That's a
day.
great
So that's what I
idea.
look at every day.
Very good. And obviously it worked for you, because now your business is thriving and growing.
Yes, it is. So I am really excited about where we're going to be moving towards. We're in negotiations with a psychiatrist right now. So I am really excited about the medication part. If we can do that, we'll definitely be breaking down barriers.
Definitely. That is very needed on the coast. I've talked to a lot of providers, and it seems like that is super difficult to find someone. So, I think about people.
Constraints of insurance, because
Mhm.
that kind of dictates the care that you can give to individuals. So a lot of times people want to be able to give as much or, as less of care that they need to, and not be confined by what insurance companies say you have to do. Unfortunately, a lot of individuals in our community don't have the financial means to be able to pay for those services out of their pockets. So we're hoping to be able to bring that service to individuals in a manner that they can financially afford.
That's great. And I was just thinking when we were just talking about psychiatrists, that wouldn't it be great if we could encourage some of these young people that are about to start college to consider a mental health career, because we need more providers all across our country.
Absolutely, more providers. So I'm hoping that something comes out of this pandemic, that people are empowered or encouraged to go into the field of mental health, because this has definitely affected everybody's mental health. Doctors, nurses, social workers, therapists, it has affected everyone. So we're going to be really busy when things start to open back up, and when things start to, get back to whatever our new normal looks like for us.
Right, right. Goodness. Well, Jocelyn, thank you so much. This has been amazing information. Before we sign off, can you tell us one more time your phone number for someone to make an appointment?
Sure. Our number is 228-220-4226, or they can reach us on our website at www.premiercounselingservices.net. And you know how to get in contact with me. So if you have anyone who's looking for a therapist, please give us a call. And just so everyone knows, we do offer sliding scale as well. So if you don't have insurance, don't let that stop you from getting the help that you need. We do have sliding scale slots available.
Very good. All right, ma'am. Thank you so much. We appreciate you.
Thank you for having me.
All right. We'll talk to you soon.
Okay, thank you.
Bye-bye.
Bye-bye.